So we're going to talk about dyspraxia. So dyspraxia is kind of the UK common name for it, but most people who work in the medical or diagnosis part of it will call it developmental coordination disorder. So developmental coordination disorder is when people do less well than expected. So you've got kind of average performance of people with motor skills, so how they move, and then people who are at the lower end of that scale are given this condition. So dyspraxia we put under the umbrella term of neurodiversity. So that means people that, as we said, are away from the average. And with that, we have other conditions such as autism, ADHD, dyslexia, developmental language disorder. And if you have one, you're more likely to have one of the others as well, or more than one of the others. So that can lead to a combination of co-occurring difficulties, so difficulties that happen together. And we would expect it's more likely someone with dyspraxia would have one of those other ones as well as having dyspraxia. So dyspraxia is a developmental disorder. So this means it's something that you have from birth. So you don't develop it later on in life. You might have motor skill difficulties later on in life, but it's from birth. So we would expect someone to have seen or noticed delays in their development. So those might be, if we've got a baby, they might have sat up slightly later, or they might not have crawled, or their movement might have been slightly delayed. But it can also sometimes affect speech as well. So speech might have been a little bit slower. So those early signs can be great for having an idea. But later on, we've also got a lot of signs as well. So we might have use of knives and forks, general kind of messiness and clumsiness, and in sports, finding it harder to do those motor skills. And when we're talking about motor skills, we've got two lots of motor skills. We've got gross motor movements, which are like the bigger movements. So we'd be thinking about sports and walking, possibly riding a bike and balance in those. And those would be more difficult for people with dyspraxia. And also some people have as well fine motor control, which are those smaller movements. So particularly handwriting can be incredibly challenging, but for some people, typing might also be quite hard, or moving a mouse. So they might need particular help with that. But also self-care comes into that. So by self-care, we might mean like doing up buttons or laces on your shoe or sorting your hair. So all of those things might come into this as well. But also with dyspraxia, we've got kind of these wider differences that come under neurodiversity. So these people might have difficulties with organisation, so turning up to places on time, or with organising their work, working out what they need to do and doing it at the right time, and sometimes with social skills as well could also be affected. Now, just to make clear, this doesn't mean people with dyspraxia can never learn these things. It just means it might take them a little bit longer, or they might need some additional help or some different ways of doing things. So we were discussing handwriting. So handwriting, instead of handwriting, we might want to use dictation, so speech-to-text technology, or for some people, typing might be a great option for them. Maybe we want to choose things that don't have really tiny buttons on or really complicated laces, and use slightly alternative ways of doing that. And learning to ride a bike, we might just want to take a little bit longer and have some additional help to do it. So sometimes some one-on-one support to learn these skills can make all the difference. And additional support in university from a specialist tutor or a mentor can be fantastic for getting up to, so you want a level playing field with other people.